everyone, and welcome to Perfectly Healthy episode number 10. We're so excited to be able to introduce our new naturopathic doctor, and Alex Aponte Davila. Did I say it correctly?
You said it correctly.
Okay, excellent. And so he'll be sharing a little bit about his background and story. And again, we're very glad to welcome him on our team. And so at the end, we will be opening up for Q&A. So you know how we kind of go along with our little PowerPoint. So hold your questions, or you can put them in the chat box, and we'll answer them at the end. Okay. So I'm going to go ahead and go to the next slide here. And most of you are familiar with me. I've been working with Dr. Keneally for over 23 years now. I'm kind of, I think, grandfathered into it a little bit. But the beautiful thing about working here is that we're always looking at the cutting edge of whatever is happening in the treatment and the prevention of most illnesses. And so what's nice is that we have a nice platform that she gives us a lot of room to be able to bring all aspects of our learning into our sessions. So I do the nutrition here, so lifestyle, that's what I focus on, is meeting patients where they're capable of really creating a lifestyle for life. So whatever got you healthy, we want you to kind of still swim in the same river. And then of course, oftentimes it's going to be more rigid in the beginning because we're looking for a specific outcome. And then we can go into a maintenance mode where it may not be restrictive, but we're always looking at whatever swap outs we did with nutrition, we want to maintain those just for overall general health, lowering inflammation, and also prevention or reoccurrence of any diseases. I also do EVOX, which is a cornerstone of our treatment plan, because we believe that every illness has an emotional association to it. And cancer is something that we look at from the German medicine side. It's a conflict, an emotional conflict. So when I work with patients, it's not to blame or shame anyone. I always say we're in human school, and it's to remember our divinity, and all of the adversities that we have in life are opportunities to, you know, have the mindset of who did we become because of them. So I say that's how you get to go up in your grade level. As if I become a victim and I become angry and resentful, then I got to stay back in that grade and then again continue to learn the lesson over and over again until we get it. And so when we come from the level of what did I learn, what benefit was the adversarial experience that caused me suffering and sorrow, how did I use it as my purpose and my passion, then we know that we can go up a level in regards of what our purpose is in this lifetime. And then honestly, it's very simple. It's just to come from a place of Christ consciousness, place of love and forgiveness, and that open-hearted, where we're able to connect from a place of our heart. So with the eBox, it's a voice activated biofeedback where I'm able to record the voice from a headset, and then it records the missing frequencies in the voice. And our voice holds yesterday's years, not just your own personal emotional environment, but also your mother's father's father. So we're looking at unentangling or de-enmeshment of emotional trauma or overwhelm. And a lot of my patients will think of trauma as something, you know, big T traumas like abuse, neglect, things of that nature, or death. But I always say that trauma is just not the bad things that happen. It's actually the good things that should have happened as well. And a lot of my patients will share with me that they can't remember ever being told, I love you, or you're beautiful, or, you know, I got your back. And so these are, you know, we would say little micro traumas, but they create a belief system on who you are and the worthiness for you to be, you know, fully healed. Because if we don't feel worthy of it or valued, then oftentimes it's very hard for us to, allow those miracles to happen. So with that, I kind of look at the whole person, body, mind, and spirit, and really kind of connecting you back to the roots that allow you to keep yourself safe. So I always call those the spiritual roots, so we can endure any kind of environmental storm, emotional storm that happens in life. And so again, I'll work with you from every level, whether it is weight loss, diabetes, cancer, or just anti-aging. So depending on what the doctor has prescribed, then I will show up for you on that level. So we're going to go to you, Dr. Alex, and so I'm just going to have you go ahead and just share a little bit about, what inspired you, and at what age did you decide, I'm going to be a doctor, I'm going to be of service to the world. So I'll go ahead and let you introduce yourself.
Thank you, Liliana. Thanks for having me today and the Perfectly Healthy podcast. This is an amazing opportunity for us and myself to share what we do in the clinic. First of all, how do I get here? Uh, was born in Puerto Rico back many years ago. I'm 34.
Many years ago.
Right?
I'm ancient then.
And but my career in wellness, I will say, started 10, 15 years ago. I was an athlete, and my family athletes, and they're very health conscious, but there's a big history of family history of diabetes, cardiovascular health, strokes, colon cancer, fibroids, endometriosis with my mom. And I was a miracle baby because the OBGYN told my mom, I don't know how this happened. And coming from Puerto Rico, I learned from how we have all these exposures, and very similar to Dr. Cornelius' story, her mother was exposed. I myself was fascinated when I learned that my mom was doing synthetic personal products, relaxers in her hair, and that's something that might have contributed to her endometriosis, right? Or alcohol intake and other exposures, that smoking, that some at the primary care level we talk about it, but not to the point that we're making change, especially when we're looking at conventional treatments, right? So what brought me here is my passion to bring and gap both sides, because conventional and holistic and natural will should be integrated and bring together the best medicine we can to our patients, right? That being said, I do have a master's in nutrition, so I do provide backup to Liliana and the nutrition department in terms of doing the assessments and helping with intake and treatment plans for our patients. There's food is medicine. It goes from not only what you eat, but we go into detail into how many times you cook. Do you know how to cook? Liliana's cookbook is great, and it's something that I do recommend to all our patients, because digestion starts when you smell the food, we touch the food, we uses our senses, right, to bring that
the joy, the desire,
the joy, yeah. Right? Because it's not something that we just use as a fuel. It's a way of life. So I'm very passionate about nutrition myself, and it goes way above just calculating macros and micros, right? We need to understand the cultural background. We need to understand what do you like, what do you don't like, and with the functional testing that we do, understand if there's any sensitivities, exposures to any type of pesticides. Where do you buy your food? Where do you drink your water? So it's something that, again, can provide a lot of answers and a lot of benefits to our patients, right? Next is I have a clinical doctorate from Bastyr University in Seattle. It's a 4-year program that I did for naturopathic medicine, which made me, I am licensed to practice medicine in the state of California, okay? And I do have a fellowship in integrative medicine from the Academy of Health Sciences and Medicine in La Jolla in San Diego. So 2-year residency in Bastyr University in San Diego, which I did more so general medicine, learned from old timers in this medicine, and now under the mentorship of one of the pioneers in this medicine over 25, 30 years in Dr. Liliana. I'm very excited to combine all these tools and seeing patients every day. I just finished seeing patients, started at 8, back to back to back, and go meet with other doctors, finish my plans, and now here with Liliana and bring all this information to you guys, okay? So
that's the good thing about youth, right?
Right.
Never run out of gas.
So basically, my specialties goes from a spectrum. Call myself as the quarterback in terms of at my level and what we're doing and what I'm doing in the clinic. I see the patient, especially in the centers of new medicine side, the new patients for optimization. So I do order all your blood work. I review any past blood work that you have sent in. I create your initial plan. So I will be referring you to different providers within our clinic, and I do communicate. If you have a primary care, which is conventional, I do coordinate care. I send them a letter, and we all work as a team for you. Okay. In the Cancer Center for Healing side, I do collaborate with Dr. Keneally, Ariel Cossey, and Dr. Colleen Galvin in terms of coordination of care, following up with the patients and providing research for them, any type of clinical support I can bring for them, and learn from them, which are one of the best team in the nation in terms of integrative oncology. Okay. I do injections. I do other type of pain management. I'm training a procedure called percutaneous hydrotomy. I do craniosacral, diabetes, you name it. I'm gastrointestinal. So that first visit looks very comprehensive. We do a lot of good work with cancer screenings, right? Circulating tumor cells, we identify that. The sooner the better, right? Like, as you know, cancer is a spectrum of 10 years, and the earlier we catch it, the more we can do about it, right? So that's where we at. And Liliana, anything else?
No, I think you covered it pretty good.
Right.
I think, one of the things that, we really want to have this forum of, we look at the whole body in regards to how we treat. So again, I always say we don't leave one rock unturned, which is a little bit different than conventional medicine, don't you think?
Correct.
Yeah.
And that's something that we just integrate, right? Like, there's a place and a time for everything, but here we are trying to provide the best care in that regard. Okay?
Yeah, and we have so many multidisciplinary, treatments, and they all integrate with each other. And as Dr. Alex said, is that every Tuesday the doctors all convene to talk about the patients and how they can support each other. And so again, it's a collaboration. So if you're seeing one doctor, in all reality, you're seeing all the doctors here because that's what we do. We support each other by being able to ask a lot of questions, right? So,
correct. I hear that a lot. I want to see Dr. Keneally. She's all booked out. You know that I'm bringing your case up to her, and she is being part of your case, although even if you're not physically seeing her, we all here we're working hand to hand, and she will, and the whole team will be supporting.
Yeah, and then we, again, we work with a lot of different labs. So, we, if we need to network out to other people that, that we don't have the specialty here, we collaborate. So it makes it, really nice, as you were saying, that if you have a patient that has a doctor that's specificity, that you will send them a letter. I mean, that's awesome because
right.
we want to work as a team.
Right.
Okay, so do you have anything to say about this one? Okay, let's just kind of go over here. So again, if you haven't been here, we are located in Orange County, where it's beautiful. I'd say, more days of the year. It's kind of like Spain a little bit,
right.
The weather. It's gorgeous here and beaches all over the place. So when people come here, they are always, get to go to the beaches and hang out and ground. We really encourage that. So that we look at healing is just not within here, it's also within the nature that we have here so beautifully. So everybody loves coming here. Okay, so we talked a little bit about getting to know Alex, and so he already kind of went through his background, quite extensive. I didn't know you were so well documented in all the things you've done, so that's awesome.
Right.
Okay, so I think we pretty much covered these things, and then as Dr. Alex said, is that the more information that you can share with us, the easier it is for us to unpack and to look at it from a point of view of what area is most important. If we're looking at cancer, for example, we're looking at the terrain of the body. We're not just attacking the tumor. We're looking at, why was the immune system compromised? Why was the immune system not able to detect cancer, seek and destroy? Well, they could have been, overcompromised with candida and parasites and viruses and heavy metals and all of the things that, most conventional doctors really aren't looking at. And so we have a lot of different type of modalities here to be able to really hone in on those things that we're going to be talking about today. And then, of course, like Dr. Keneally says, an ounce of prevention is always the best way to treat, because it's a lot easier to prevent than to treat. So our goal is to give people, the information that they need to make really good, healthy choices, whether it's through your diet or exercise or sleep or your emotions or even the treatment plan. And, we want it to be complementary to what you're capable of doing as well. So I'm going to go to the next slide here. So we talked a little bit about the health history. People always say to me, oh my gosh, it was this thick. And I said, yeah, it's pretty comprehensive, and it's, more than probably what you will ever have to answer. Did you have a C-section? Did you have any trauma? What kind of a whole environment did you have in your home? So we really want to look at everything, because we realize that, childhood maladaptation can create labels, it can create, belief systems that can create disease. So we want to go all the way back to, the origins. And so it makes it a lot more easier for patients not to feel that it's their fault that they have what they're going on, that this is a process of, a spiritual a journey that needs to be revealed and then taken ownership over. I always say that you only have control of how you think and feel. So if you're thinking and feeling in the moment not so positive, you're going to have stinky thinking, stinking chemistry. So when people really realize, wow, you're right, I don't have control over the future, but I do have control over this moment. So again, we do a lot of different assessments and on all levels. And stress is, I would say, by far, would you say that most patients that come in here, the bottom line is, the inability to handle such a fast-paced world and such a chaotic environment. I mean, we're getting bombarded in every level, from the TV set to the phones to everything. So I always say, just think about your own personal zip code and deal with that. Your inner sanctum, your family, your close, not outside in the world. We can just bring our hands up and bless the world at large. But if we allow that to come in, it's like inviting a virus into our home that emotionally, can create a lot of problems. So we really work a lot with stress, and then again, moving it out of the body, and that's through exercise and through breath work and through grounding as well.
Let me comment on that slide.
Okay.
Quickly.
Okay, go ahead. Do you want me to go back? Let me see. How do I go back? How do I go back?
If not, it's totally
there
fine. There you go. So with medications, we assess that because so medications can deplete you from certain minerals and vitamins, right? They're tools, but at the same time, certain medications, for example, metformin, used for diabetes, can deplete you from B12, right? So if your conventional doctor or your prescribing doctor or whoever is not checking that, that's doing a disservice. Or if they statins, same deal, they deplete CoQ10, vitamin D. Certain antidepressants can deplete certain B vitamins, zinc, copper. So we do that type of work here. Then looking at your supplements is important, because there's so many brands, there's so much misinformation out there, that we are the professionals that take care of that. We spend the time studying and understanding what brand, what product is the best for you. And there's been something that we, over 25, 30 years with the store here, all the products we carry or we recommend are validated, right?
Yeah.
In terms of the history, we do something called your health inventory by decade. So we go 0 to 10, 10 to 20, 20 to I want to know how many rounds of antibiotics you did. I want to know if you're vaginal or C-section baby. Any trauma. So there's this research that shows that at adverse childhood events, if you mark more than 2, which is a couple of events growing up, you're predisposed for a lot of conditions. So want to make sure we document that. We get to know you. We see you eye to eye, right? That's where healing happens, right? That's what I want to add to those to the consultation. Uh,
And we're not anti-medication because a lot of times we use medication for repurposing with our cancer patients, like, metformin, for example, or ivermectin, or any of the other,
Right.
anti-parasitic medications. So again, we use them as a complementary a lot of
Right.
times as well.
It's a tool, so
Yeah.
we are going to educate you, and we never de-prescribe. We never tell you stop without the proper counseling, coordination of care, and education for the patient, and understanding the risk and the benefits of it. Correct.
Yeah, and then also, like you were saying earlier, if we're going to give somebody a statin, we make sure that we give them CoQ10,
Exactly.
so that we know what depletes and what they're going to be needing, so that doesn't create another issue for the cardiovascular system.
Correct.
Okay, so let's see. All right, so the oblioscan. So you're really quite familiar with oblioscan because you were doing that for a while. So I'm going to let you talk a little bit about this.
Right. So oligoscan is one of our functional assessments that we do in house. Right. This is something that can monitor heavy metals. It can monitor minerals and vitamins instantly using a technology called spectrophotometry. Right. Sounds too good to be truth. Right. But clinically, I've done over hundreds, almost thousands of these tests, and I've seen that we are correlating this history. I've seen patients following up at 3 months and seeing changes in this test. It can help us guide a decision in terms of supplementation. Non-invasive just uses that technology called spectrophotometry, validated within the testing, and there's no needles. It gives you a report instantly, and again, it's just one more piece of the whole array of testing that we do here. And it can guide my decision or our decision here in the center to, okay, let's move on to the gold standard, which for heavy metals is a provocation with provocated urine tests, or I can do a nutrition evaluation through the blood to see your levels. So again, it just guides the decision. It's something non-invasive. We usually repeat this every 3 to 4 months just to keep track of your changes. And as you know, heavy metals can can block the absorption of some minerals. So that can be the root cause of why some of the minerals are off, or there's competition within each of the other minerals, like calcium and iron can compete, or you want to take from different times, right? And it measures intracellular levels, whereas blood usually looks more of a serum. There's some that looks at red blood cells, but this is more intracellular, which is a good representation of what's going on for yourself in the last 3 months.
Inside the cell, which
right,
is great.
in tissue levels, right? So something very useful. Again, it's functional,
and it's fast and it's easy. I mean, really, it's just 4 marks on the hand scan, and it's pretty amazing how quickly it comes up with the information. It's like, wow, hard to believe, but it's very accurate.
Right. So that's something that we do in office. 45 minutes, including a consulting with one of our providers here, or right now one of our doctors, Dr. Rachel Merriman, is doing the testing, and she can go through all that. And I see it more as well as an environmental medicine consult, because a lot of this information is reinforced exposures. I see it as a mini nutritional consult, because that's where, I forgot that I have been taking zinc in COVID. No one told me to stop, or a lot of this information, interesting information is coming up in this session. So very, very interesting. Another interesting fact from this test, that gadolinium is what we use for contrast for MRIs. And I have this patient, she hasn't done imaging ever. Like, she doesn't do it like imaging. And her gadolinium was high. There's a hospital by her, and there's research showing that if you drink water or you shower with water close by with gadolinium, you can be exposed. So it opens the conversation for a lot of these exposures that sometimes we were not even aware we were having, right? But yeah.
Okay, beautiful.
Right.
And then the bioimmune survey, and this is something that one of our practitioners does, Molly. And again, Dr. Keneally and a lot of the doctors really rely on this test. As Alec was saying, it's an opportunity to say which direction do we want to go? Do we want to do further testing? And so again, we have a screening so that we can look specifically, for cancer. We do the 64 points of the hands and feet. And then so she's checking with kind of what's it called? Kind of like electro-screening too, but what's it called? A stylist. It's called a stylist, okay? And she's checking the meridian points, and it's fascinating, once again, how much information the body actually can express itself through frequency. And so through that, Dr. Keneally will always, if we're looking for, the terrain of the body, is it, an environment that is, ripe for disease, it's going to show up in these testing. And then, oftentimes it'll show, and then later we'll get a lab test down the line 2 or 3 months, and, it comes up on lab tests. So we rely on this test a lot. So it can look at, just kind of similar what this was looking at, all of your toxins, your heavy metals, your virus, your bacteria, your parasites. It could look at your stress level, your nervous system, all of your organ systems. And then if we're looking for screening for cancer, we've got vials that represent each one of the cancers that we get a positive in regards of the charge, where it kind of goes in a green, we've got a match, then she'll start looking on all the other points to see if there's a potential risk of that particular cancer in other parts of the body. So again, we're looking at blockages, we're looking at pathways, we're looking at overload principle. So this is a test that I would say probably 90% of our patients will go through at some point, as a patient here at the Center for New Medicine. And if you're a new patient, this is part of the new patient package because it gives us a lot of information very, very quickly, just like the Oglio scan.
Right, and it just gives the providers, me being one, a good systematic approach to, okay, let's start with candida and parasites, then let's move on to heavy metals, let's add X, Y, or C. So all of this functional testing, what enable us is just to see the bigger picture and do more of an educated, in conjunction with the clinical history or blood work, more of a systematic approach to how we will look in the next 3, 6, 9, 12 months of your treatment.
Yeah, because cleaning up the terrain is really important, even, before treatment a lot of times, right? Open up your pathway, work on, candida parasites, because, of course, when we're looking at the functional side, we look at, candida, the mold and parasites, as a very complementary to cancer, or even, as we'd say that what came first, the chicken or the egg, and a lot of times in terms of the terrain. Anything else you want to add to this?
Oh, we can.
Okay, let's move on. Okay. So the 3D body scan is also what Molly does. Now the first one is going to be looking more specific for viruses, bacteria, elements of the potentiality of disease. And then this one is just, again, very quick. She does a 3D body scan. And so it's going to look for, stress, fitness, postural, but it also kind of just a full, like if you were doing an imaging of the body. And so I would say the other one is a little bit more comprehensive in regards of actually looking at, avenues where we would want to go down. But this is kind of like a snapshot of everything.
Right. Actually, we want to, if possible, do both at the same day, because it will give you that picture of vitality and then physical realm, emotional realm, and spirit. And it's
very complementary to each other.
Right.
And then, of course, there is specifics in regards to when you, before you do this test, we want to make sure that, you follow all of the ground rules of no massage, no exercise prior to, the day before, coffee, things like that, because it'll all affect the nervous system. So we have pretty strict parameters so that your test can be very effective. Okay, the live cell analysis. I love live cell analysis. And, I did live cell analysis. I did phase contrast, where Teresa is doing here. She does dark field. And so it's wonderful for the patients because, it is virtual. You take a pinprick of your blood, you put it on a slide, and that's you right there, 3D. So it's like, okay, you got the visual actually makes you really realize, oh my gosh, these are the changes that I need to make because I'm seeing them here. And so the live blood cell is something that we also do, in our new patient. But again, it's looking for, again, the terrain, the acidity. And what I love about it, it even holds the history in regards of, injuries, in regards of the formation of some of the blood cells and stuff. So she might say to you, I see that you had a head injury at the age of 2 years old. And you're just like, what? So the blood holds the image and memory. And so we're looking at everything from the white blood cells, the red blood cells, or activation. If we have, more of a certain kind of eosinophils, things of that nature, we can, potentially determine that, their parasite activity, or, more fungal activity or allergens. So it kind of gives us, again, a more in-depth into, what other testing that we would want to do. But again, when you see it 3D, it's pretty interesting, right? You can see a white blood cell gobbling up some bacteria. And you can kind of, if you have anemia, you can see that as well. You can see the detoxification into the body, dumping protoplasts into the blood system. So this is something that I find fascinating, and all our patients walk away with like, wow, that was amazing. Because when she's looking at the dried blood, she can be looking at, the scope of it all, like, the first couple of years, and then each one goes down deeper, deeper, and deeper in terms of the severity of what she's looking at, whether it's inflammation or the gut or the cardiovascular system. So it's pretty fascinating.
Yes. Yeah, it's one of the tests, again, that we use. We see the whole picture. These biosis can be inflammation in the gut, trauma, like you said, head injuries, joint pain, knee pain.
Yeah.
For example, when I did mine, I have very chronic knee pain, and she doesn't take any history. She goes and asks me all the things, and yes, and it's a functional test. Of course, it's something that we just use as a whole, and is the experience that we're seeing here, right? Like the technicians here, all of them, many years of experience in this, certifications in this area, and they know what they're talking about, right?
Yeah, exactly. I love it. Okay, so nutrition. So again, the first thing we want to do is, get a little history. What have you been doing? What do you prescribe to? A lot of our patients come here very educated. They've researched. Most of them, I'd say, well, I won't say most of them, but, a lot of them aren't on the standard American diet. I call it the SAD diet, right? Most of them are educated to, when they can, have organic foods. They're looking at their, oils and pesticides, things of that nature. So that's the kind of the first thing that I want to do is just kind of what have they been doing? What is their philosophy? If somebody's a vegetarian, I'm not going to try to, get them to be a meat eater, because whatever you believe to be true is what's going to make you well. What I would look at is how can we make what you are doing that you believe in the healthiest that we possibly can do. And then sometimes, if they're, stuck into the mindset of that's bad, or, then they're not open to it. So again, being really patient and saying you can be your own personal experiment by, trying this out, see how it does. And okay, if you maybe, they're very anemic, or let's just say they are in cachexia state where they've really wasted a lot of muscle, and they've been eating, raw foods or vegetarian, and that hasn't been working. So we kind of just gently kind of say, well, what are you willing to do? Are you willing to add some eggs? Are you willing to add some fish? And then, of course, we're not an advocate of meat in every meal, because we don't want the acidity, but we want a very balanced way of eating. And so, my goal is, food should be joy. Some people, like Alex said, him and I, we love food. We love to cook. We love to eat. We're Latinos, everything's around food. Most people, when people come over, it's about, of service and families and things of that nature. So food should be enjoyed. It should be glorified. I always say your diet should not be worse than your diagnosis. And some patients do look at it like that, especially, if they've got to do severe diets, if they've got glioblastoma and they've got to go do a severe ketogenic diet, or pancreatic cancer. And so it makes it hard for them on an emotional level. So really about 80% of the time, I'm doing the emotional side in a nutritional consultation, and then 20% nutrition, right? But it's important for them to prescribe and to really recognize that, yes, food is a very dopamine, pleasurable thing. We do not want to deny it. We don't want to take that away, but how can we make sure that it's whole? Looking at food from it, like I like it looking at a mathematical equation. I say, you're just a chemistry equation. So, if we want to treat candida, cancer, and things of that nature, we've got to have very low, glycemic foods and that, produce a lot of glucose. And some people don't realize that, let's just say a banana is 25 grams of sugar, or a piece of, or a bun, is 42 grams, or French fries. And so they realize, oh my gosh, I had no idea that I was consuming 80 grams of sugar at one meal, and then very little protein. So if I can give the patients the science of food, they can make the right choices according to whatever condition that we're trying to treat. I give them the options, but at the same time, Rome wasn't built overnight. So, I say, okay, well, let's even start with the drinking of the water, making sure you have clean water. And the first thing in the morning before you put coffee into your system, okay, the morning is the elimination cycle. So how are we going to support that? And then, a lot of people are into intermittent fasting. I think that's terrific. Cyclical eating and so forth, supporting the digestive system. But again, men do better with intermittent fasting in the morning, where women do better with intermittent fasting as way as just eating earlier and then having a longer period from nighttime and then eating protein in the morning. Women do better with that than men can get away with, waiting till 11 or 12 o'clock to eat. I don't know if it's their testosterone levels or that they house a little bit more glucose in their muscles because their muscles are bigger. But I've found that is much better for women, is to have protein in the morning and then just cut off their eating window, like by 6:30 or something like that would be great. And so optimizing it in regards to what they're willing to do, what their philosophy is, going to complete natural, getting you off all processed foods, all bad oils. If it's in a package, and it's got more than 3 ingredients, put it down. Like even with, your nut milks, it should just have water and nuts in it, right? And so if we can educate the patients to read labels and look at them from the point of view of even, a label that says serving size 1, and then I say, look at the word total carbohydrate. That means total sugar, even if it says no sugar added. You can deduct the total fiber from the carbohydrates, and then it becomes a net in that amount of sugar. So a lot of people, still go, what? Oh, I didn't realize that. So our goal is not to take away all your joy, and we say, okay, let's have swap outs. So that's why I decided to create a cookbook, because I love to eat, and I'm a self-taught gourmet chef. My mother was too, and all my sisters are as well. So, it was like, what kind of swap outs can we do? If we want to have, mashed potatoes, can we do cauliflower mashed potatoes or cauliflower rice, or we can do a keto bun, or we can have a keto pumpkin pie. And so again, people, a lot of times they say, oh my God, your cookbook is my Bible, and we have it with a lot of anti-inflammatory herbs in there. So it's medicinal as well for everything from, cancer to metabolic syndrome, to weight loss, to diabetes, to heart disease. So it kind of covers it all, which is really nice for our patients. So again, my intent is to get you as close to nature as possible, and then balance it out so that your, blood sugar is stable. Most of the time, it's going to be protein here and carbohydrates here in regards of just prevention, even anti-aging for the brain. Of course, when you're young and you're in reproductive state, no, you need carbohydrates. If you don't have enough healthy fat, you're not going to get pregnant. So, just depending on, what it is that you're here for and your age is kind of the direction that I will go with the nutrition. But our intent is organic, clean, whole foods. We don't want meat at every single meal. Sometimes, when you have gut issues, we might prescribe a carnivore diet for a short period of time, or we may prescribe a more rigid ketogenic diet for a period of time, but not forever. Nothing is forever. So I always say, we are going to be a personal experiment. We eat, we feel, and then, when you tell us, we're able to help you, make changes and shift it. So again, most people know, bad oils are just not going to be utilized for hormones. So again, they're just going to stick to the arterial wall like plaque, create more havoc for the liver. And so it's pretty simple. Right now we're living in a time where everything's accessible to us, right? And so it might be a little bit more expensive, but I always say you are worth it. And then again, I don't like to look at good and bad food, because then if you eat something bad, then I'm a bad person and I feel guilty, and then I go on the scale and I gain weight and I say, you see. So I just say, there is foods that are real and foods that are not, okay? And specificity, low sugar, high sugar. If we're dealing with a specificity, it's not that these foods are bad, it's just that they're inferior to the mathematical equation A may give you. And so I say, it's somebody's medicine, but for what you're dealing with, it's not going to be your medicine. We need to, reduce the glucose level. We need to treat diabetes. We need to do things of that nature. So again, I don't like to look at things as good or bad, unless they're actually, a processed food, a food that isn't, of its natural source. And then of course, I always tell my patients, fat doesn't make you fat. Okay, it's the carbohydrates that make you fat, and stress will make you fat. So, the fat we love, it's really important. When they took the fat, out of our diet, I think it was like in the 1970s, cardiovascular disease went up, and they, that was the Food and Drug Administration, and they put in bad seed oils and, frankenfats and so forth. So they called that the snack wall phenomena, right? Where they started having all of these processed foods, and obesity went up, heart disease went up. It did not go down. So again, my goal is to meet you where you're capable of having a lifestyle for the rest of your life, with the mindset of, yes, we want flexibility. We don't want to be rigid, because we don't want to have anxiety behind what we eat, or PTSD. If I eat that, this is going to happen to me. But also, with commitment and intent. Anything you want to add to that? Mr.
No.
I didn't even know you had a master's degree in nutrition. That's good. I'm going to pick your brain some more.
Right. I study a lot, but based on we're talking about, nutrition is one of those sciences that are not specific. It's ever-changing. Studies are hard to apply for specific individuals. Our biochemistry is different, our genetics is different.
Detoxification pathways are different.
Is different. That's why we test genetics. We look at if you have any type of methylation issues. We look at that's related to nutrition. If you have any type of eating disorders, something that we check, and if we have to refer out, especially when we're having very strict and very rigid diets, we can trigger emotional issues. So we are very aware of that. Financial access to food is something that I check it with my patients, right? Like, want to make sure cultural background, make sure we're respecting all those parameters as well. And there's certain foods that organic works, but I understand it's not practical all the time. So there's certain things and tools that we can provide you to find the best. For example, there's a clean 15 and dirty dozen list, or we want to make sure we teach you how to clean your vegetables, or use UV light to disinfect your salads, and be aware of public health and understand when there's an E. coli outbreak. That's part of nutrition, right?
Yeah.
And exercise goes hand to hand with this. Like you said, we want to have energy, we want to move, and food is medicine. And this is something that, like, oh my God, I just even ask teeth, like the way you chew, how many times you chew your food. Do you
under
watch
stress
TV?
when you're eating?
Right. Are you on the run? Are you driving? Are you digesting your food? Right.
Are you blessing your food? Are you happy when you're cooking? They say my mother used to say, if you're angry, don't cook. Because you've put the energy into your food. And so, we all take that, very seriously. So it's a time to be quiet, to enjoy conversation, not to bring up the politics, not to bring up the stress of the world. This is a time where we're in the mindset of digestion. So we should be resting from all of those other things, and, being in a calm state, which is super important.
Right. Even the timing that you eat, the order that we eat, the carbs, the protein, the fats matters. Even if you drink tea, black tea, coffee, too close to your meals, it can block absorption of some nutrients. So it's a science that it's very, very deep. And again, we do it every day, 3 times. It's like sleep. So this low-hanging fruit lifestyle determining effect, we all do this every day, is what makes who we are, right? Yeah. And want to make sure you have all the education needed and the tools you need to succeed in that journey. In this case, we're talking about nutrition. It's the
Make it
spectrum.
fun. Make it fun, right?
There's no good or bad. We
Yeah.
just need to find what works for you. And there's different testing that we can check for genetics that we can do in our office, if you're interested. Okay.
Okay. Let's see. So the MEAD. Do you want to talk a little bit about this?
The Meridian Energy Analysis Device. So this is a assessment that we do in office. One of our technicians perform it, and it checks basically for your voltage. So in our evolution, our voltage usually comes from grounding outside, working in nature, having time under the sun, etc. Following the circadian rhythm if we can, and with time now we spend 90%, 80% inside a box, right?
Mm-hmm.
We are not connecting, we're not grounding ourselves, we're not touching the grass, we're not breathing fresh air. And this is something that our brain, our heart, they're electrical, right? And our polarization systems in our cells, sodium, potassium, to create that charge, we need the right nutrients and but also we need the right exposure to all of this and to optimize it, right? And that's what we're doing with the meat. Also, if we're exposed, there's certain types of EMFs that or electromagnetic fields, and that's well documented right now in the literature, that can affect how our brain is a sensor, right? It's a magnetic sensor. All these frequencies can be affected. Same with our heart, like emotions, broken heart syndrome, right? If you take a teeth out, your meridian circuited, so your body's a circuit.
Yeah, circuit.
And we're missing one part. Of course, we can still work, or your car can still work, but it's not optimal, right? And that's what this test check for. Meridian Energy Analysis Device, that's what MAT stands for. And we have certain devices that can help
bring the voltage
back to that where it should be, to promote healing, right? And that looks like the biomodulator. We have a biotransducer, biocharger, scanner. And if you have more questions, one of our technicians can explain this to the detail and with all the research behind it. But I've seen, especially for nervous system dysfunction, for example, POTS, or postural orthostatic syndrome, for any type of numbness, tingling, and while we find the root cause, is a good thing we can do while we work and figure what's going on with your nervous system, or we reprogram your nervous system. So there's great tools to get that charge back and promote healing at that cellular electrical level. Okay. Anything?
Yeah.
else
So again,
you wanna-
we're just talking about our voltage, and it's interesting. We have 40,000 sensory neurons in the heart, very similar to the brain. So it has its own neural network, but it thinks independently of the heart. So I found that really fascinating. So and this is why when people are having an anxiety attack and you look around and there's really nothing, no predators, no real reason to have one, is because the heart has a thinking, and if they get triggered by something, the amygdala, the emotional part, will hijack, the critical thinking, and they end up in the ER thinking they're having a heart attack, but it was just an anxiety attack. So this is why heart and mind coherence is really important, because, I say that every negative thought we have is a depleter, and it lowers that voltage that we're talking about right now. So if you kind of think of, when you plug your cell phone into a charger, you expect in the morning to wake up with 100% battery. And then again, if you are looking at apps and you don't close them, then it's going to, lower your battery, and you're going to have like 2 bars. So that's kind of like with the emotions. So I tell my patients, any negative emotion you have is a depleter. So for example, if I'm having resentment, that's going to deplete my frequency, and it's going to create a chemistry within myself. And so I tell my patients, just say several words: depleter, I choose peace of mind. Depleter, I choose love. depleter, I choose this. So it doesn't need to be difficult. It just needs to be mindful, because, again, that lowers our voltage. And so by the time, we want to actually, have some quality time for ourselves, go for a workout, go for a walk, we don't have the energy, because we have been, allowing all of our emotions, besides the environments, the environmental toxins and, exposure that we don't see, to deplete our frequency. And this is why it's so important to ground, to get into nature, to have love, to have connection, to have movement, to have exercise, circulation, because, it brings back up that voltage. I love sound bath therapy, and any kind of, we do here every so often.
Yeah.
We'll do like sound baths and gongs and things of that nature.
Acupuncture.
Acupuncture is fantastic. That will really help a lot with increasing the voltage.
OG way to get that voltage up, right?
Exactly. Excuse me. One more. I never season one.
There you go.
Okay, that was called confirmation. Sneezes are confirmation. So so there's so many things that are depleters. So you just want to be mindful and just say every negative thought I have as a depleter. And so if we can just look at it from a point of view, how do I know it's true? What benefit? If it has no benefit, it's got to pull it out like a weed. And what am I going to plant in its place? So our voltage is really important. We don't connect with nature. We have rubber soles. We don't have leather soles anymore. So it takes effort.
And we're exposed to, again, going back to the topic of the electromagnetic fields, the Wi-Fi, the headphones, the
5G, the everything.
All the towers around it. And so also, to yourselves to communicate the best, we want to make sure it's amp up and there's no disruption. So heavy metals and taking out, removing them, eradicating candida and all this agents that can interpose between that communication. That's where these can happen, correct? So we just want to keep you healthy there, okay?
And so you want to talk or shall I?
You
We can talk.
do-
Okay. Well, the F scan and the Firefly, I
so-
love it. I think it's great. It's just another one of our bioenergetic testings that very, very quickly is going to scan for bacteria, parasites, viruses throughout the body. And so we also have treatments, depending on what it is. And so it's a multi-spectrum LED light that, our practitioner will go over, usually the GI system area, and, really try to reduce the pathogen. And it's great because, a lot of people, after they, let's say, do, a light therapy, they will report to us that they actually passed, a bunch of parasites, And so we are all about trying to reduce that load. Everybody has parasites, it's just part of the I call it the milieu of the body. But again, if parasites or viruses or bacteria grow out of hand and you've got an imbalance, then that's when we start having problems, or that those parasites, they invade other organ systems. And a lot of times, when we see cysts and things of that nature, it could just be a parasitic in nature, a sac of that. And so we take that pretty seriously. So we always recommend, parasite detoxification, especially around the full moon when the body is, more apt to express, symptoms of parasite, itchiness or grinding of the teeth, or, hard to stay asleep and things of that nature.
Cysts also.
Yeah.
It's related to parasites in Chinese medicine.
Yeah, and someone asked a question about, a cyst on the spleen, right? And so the first thing that, we were talking about it could be parasitic in nature. So we don't ever want to rule that out. So and the thing is the testing for parasites, like in blood or in stool.
So gold standard is a sample 3 days because they're sneaky. We want to make sure the ovum, we get both the parasite and the ovum, the eggs, and that way we can 3-day sample. But this functional assessment is great because sometimes they're hiding in the pancreas, they're hiding in the gallbladder, they're hiding organs that it's hard to pick up. So
and they latch on the intestines, so they don't come out.
So with this frequency, we can match in three treatments with the Firefly. We see benefits, but of course we have that in conjunction with the conventional testing or a functional comprehensive stool test to confirm.
Yes. Okay. I'll let you talk about that.
Right. So just follow-up appointments. This is where after you have completed all the functional assessments in-house and completed all the lab work, blood work, We follow up even sooner in some cases, depending of the urgency and the severity of your case and complexity. We might follow up in a week. We might follow up in 2-3 weeks, depending on your case, right? We are communicate very closely with our patients through our portal, answer any questions, or if we need to book a phone call, we are very supportive and we are there for our patients to answer and make sure they understand their treatment plan and their treatment plan moving forward in our center.
Yeah, and so again, things can be overwhelming if all of this is very new. So again, it's really important to be able to have an advocate that helps to support you, kind of holding your hand through some of these things. So I always say to our patients, don't hesitate to reach out. You don't need to be a good patient, and not say anything because, you're not the doctor. Something didn't, you got a little nausea or this was too much, you need to verbalize that test so that we can make adjustments of that as well.
Right.
Okay, let's see.
So here what we have is some of our functional and testing that we do in-house in terms of QT imaging, that's for breast assessment for screening for breast changes and determining what we see. We either do more imaging or we are monitoring any type of dysfunction, something that there's only handful of centers that have this technology in the United States, and we are honored to be one of the only ones that have it. And it's a great alternative if you decline any conventional testing in that regard. That's your option, your decision, but we are here to provide you with options like QT scan and thermography for your breast, right? Other things we do in-house is IV therapy. I'm a certified IV practitioner. I've been doing IVs for many years now and just formulating, bringing what's new, getting educated, and there's a lot of benefits. It's one of those therapies that you do one and you feel better. So I like that. And we create a protocol. We have multiple ways that we can add these IVs to your treatment plan, okay? And different type of functions in your case, okay? We have a sauna in-house, we have lymphatic drainage, we do have, like we talk about blood work, we do have phlebotomy in-house, so you don't have to go to one of those cold labs or centers. You have questions, we're here, and you get your phlebotomy here with us, and the customized nutritional supplement plan. So we do offer 15-30 minutes appointments just talking about supplements because there's a lot of questions. You can meet with me or one of our providers.
You can check with a bioenergetic testing.
Right.
You can bring your supplements in and we can test to see, how they interact with you, energetically. So that's always kind of fun. People might wheel in a whole suitcase of things and they're like, oh, this is going to be a long test.
Right. So that's something that we do in office and great alternative to decide if that's the best choice for your case, okay? Any questions?
I think we have a few here. Okay, so it says, I've been a patient at this center since September of 2024, and I've tried to heal my ulcerative colitis with a few protocols. I have seen small improvements for a while, typically while I'm doing treatments at the center, and then it starts to decline. The goal was to get my gut healed to a point where I could start dealing with my parasites, but it seems that it's not working. So all this is to ask, is there a time and place for someone to go on a biologic with the intent to heal the gut to the point where I can deal with parasites and then stop using the biologic?
Great question. So anytime things are not getting better, we need to figure that out, right?
Yeah. Turn over another rock.
Want to check adherence to our treatments, what's working, what's not. For example, I don't like herbs, so let's not prescribe you herbs, or I don't do pills, let's not prescribe you pills, right?
Or even some of the foods that you might be consuming, or creating inflammation, or allergenic responses. So
correct,
especially when it comes to the colon.
You're right, correct. So
stress.
Just zooming back, seeing, okay, where we at, what work, what doesn't. Seems like we are expecting this improvement, we're still here. Then let's check in with ourselves, the practitioners, and see, let's read back the notes. We'll see what you have actually done of our treatments. And then we'll move on into, okay, let's see what other options do we have. So it seems like in this case, they want to go to a biologic, which is one of the treatments that gastroenterology would recommend in this case, and depends on the symptoms, right? How your quality of life is going.
The stress level, right? I find, is very impactful in regards to the ulcerative colitis.
Right. So we'll need to confirm diagnosis. So I'll go back and confirm the diagnosis. I'll look at blood work, right? So I'll look if there's ways we can monitor this. So CRP, ESR, inflammatory markers, scalp protectin, doing a comprehensive stool analysis. We want to look at pain.
Bacteria, H. pylori.
Correct. So, but H. pylori is more so, that's more upper GI tract, right? Like with ulcerative colitis, we're looking more so and lower tract, and want to see how your bowel movements, because sometimes that's another thing that patients don't see the progress because they were
constipated,
looking, exactly. We're looking so microscopic that if we don't zoom back, maybe you came in with constipation, pain, it was hard to work, and when we zoom back, you actually now go to the bathroom daily, or there's small wins that we also want to reassure you things are moving the right way. So to answer this question, if there's a time and a place for someone to go in, absolutely. We will just need to determine we'll do a shared decision making, but before we want to try all the things before we get there, right? So in the office, I'll decide, okay, have we tried acupuncture, this,
castor oil packs,
X, Y, C, D, and how this is affecting your quality of life, and how adherent have you been to the treatments. And then there's natural aloe vera. There's wonders with low dose naltrexone myself. So I'll check and then see all your options, but we provide all alternative and integrative and conventional treatments are in the table. We just need to know where to introduce them. So if this was my patient, I will have this conversation very honest in office and see, okay, let's discuss and see if right now is the time or not. So that patient, I would just recommend maybe zooming back, seeing what things, write it down. Like, okay, I've tried this. We can print all the chart notes for you, and we can see what's going on and take it from there, right?
Okay, so if you are a healthy 35-year-old and have found out that you have the BRCA1 with lots of breast cancer in your family, but don't want to do any preventative surgeries, what is your best advice for monitoring and advocating for yourself?
So the question is an interesting one. So this is I am assuming a female because it's 35. BRCA1 is, so for those that doesn't know, BRCA1, BRCA2, those are genetic tests that we do at the primary care level to determine risk of breast cancer. BRCA1 carries a big risk of at least 60% of breast cancer, right? So the question, if there's already a significant family history, they don't want to do preventative surgeries, and what will be the best advice to monitor? So active monitoring, we don't want to wait. We don't want to wait until there's dimples or symptoms or a little mass, and we want to be proactive. So in this case, I'll take a very good clinical history, know what's going on, do a physical exam, or ask them if they're doing self-checks at home that they are, actually right now there's good literature debating if self-checks are at the same level of the checks of the office, because you know your body best, right? You usually it's a partner or it's yourself that find the mass because you know your body the best, right? But then the question is, I don't want surgery, the preventive surgeries, which that means either single or double mastectomy, right? That's a very personal decision. What we do in the center, I've seen Dr. Cadilli go through this many, many times, is personal decision making, understanding the risk, talking with your partner, talking about with your family, understanding all the benefits of the risk of this surgery, right?
And then would we look at also to, like, the bioimmune test, and then maybe the RGDC or the circulating tumor count, or something that would kind of, give us an idea of what is festering?
So what Liliana mentions, there's a test called RGCC OncoDeclare. It's one of our functional lab testing that can help us see if there's circulatory tumor cells, and if it is, we can do other testing like OncoTrace, Oncogenomics Plus, or Oncogenomics or X-rays. And this depend on where you at in the spectrum, or the spectrum of your case. We can order them and understand where we at in terms of your rest circulating tumor cells, the type, what therapies works best for that specific cancer, or in either chemo or also with herbs and supplements. So it's a great test that we do here. It's a lab in Greece. We've been using this test over 10, 20 years now. Okay.
And then lifestyle modifications are important as well.
Right. So that's a very, very good question that we will just need to understand the rest, right? Like, see the whole picture, look at the blood work, inflammatory markers, other tumor markers, right? There's many, many things we can order and monitor consistently through. We don't want to wait 3 years, 5 years. We want to be doing this on a monthly, yearly basis, and so once we determine that rest is stratified, right?
Okay, what can I do naturally to help with endometriosis?
So endometriosis, what we can do naturally. So it's hormone balancing, which is a very cliche right now, mainstream hormone balancing. What does that even mean, right? Like, hormones is a symphony. Everything is in order, following the circadian rhythm. If we wake up at 6, go to bed, hormones should be. But there's endocrine disruptors, that meaning toxins that can affect this symphony or this harmony in your hormones, right? And it can happen. There's this
microplastics,
right? Microplastics. Fluoride have been shown to affect the pineal gland. There's many endocrine disruptors that we don't even know, right? Heavy metals, fillings, personal products that we use like deodorants, or that have certain toxins that are affecting our endocrine system, right? And Dr. Keneally, in her book, The Cancer Revolution, the second edition, she goes into detail with all of this, and it's fascinating. It's one of the things in this medicine that is fascinating for me, because we don't talk about that in the office. Like, we do, but in general, and unless something is happening overtly, but like if you were exposed to a radiation that you didn't know. I have patients that, okay, I do exercise all day. Do you know that there's radiation that can be affecting and can be disrupting your hormones, and that can lead to the signs like endometriosis, which is just a label of that tissue is we're having problems. And nutrition
have the
can
nutrition,
help, sleep, hygiene,
exercise,
and community
stress management
can help with hormone balancing and blood work and understanding, and then doing the proper imaging and clinical and physical exam in office. So things, there's DIM that you can do, broccoli sprouts, something that we can consider phytoestrogens, that I want you guys to understand. It's not the same as exogenous hormone or synthetic hormones. It's phytoestrogens can just help you bind. They bind weakly, but enough for your body to get the signal of estrogen, but not enough to create a high estrogen levels, right?
Yeah.
Which can create symptoms and problems, right? There's another thing that you can research called seed cycling. So what you can be is taking, you'll be taking some certain seeds during your follicular and luteal phase, and you'll be surprised. I have patients that are 40 years, 50 years, 30, 40, 60, and they don't know follicular, what is luteal. It's just understanding and knowing your body. That's why they call the menstrual cycle I told our medical assistant here, that's one of the vitals. You need to ask the last menstrual period and as part of their vitals, right?
Yeah.
It's one of those things that can tell us. And there's many other things that we can do to check, like hormonal imbalance as well, okay? DOSH test is a functional test, a urine test that we do to see the whole hormonal pathway, and something we can order. Dry test, you do it at home, and that can give us a lot of information on where we are in terms of hormones. And there's many things we can do for endometriosis. Herbs,
Castor oil packs with heat.
Right, exactly. There's specific herbs that can help with nutrients, like nettles is a great nutrient rich herb that can help with endometriosis. Then there's other things like you were saying, Liliana, for pain, castor oil packs,
With heat,
heat, etc. Acupuncture, great for endometriosis, and then removing the toxins will most likely help, right?
Says my PET scan revealed a cyst on my pancreas. Should I wait for the recommended 1 year for an MRI, or shall I have it checked out? I think with further, or have it looked at sooner? My doctor said it's low risk.
So this is an interesting question, because if you go to the point that you're doing a PET scan, you're high risk. There's something going on. You already have a history of cancer or something. You just don't order a PET scan out of the blue, right? So if we look at that, and the PET scan can still miss things, right? So we need to do blood work. We look at your pancreatic enzymes, and we'll look at a whole battery of tests, and there's certain cancer markers that we can look in blood for, specifically pancreas. We can look to some.
About pancreatitis, does that kind of create like a leakiness in the pancreas where all of a sudden now the enzymes can create the cysts?
I mean, totally. I mean, we were talking about that earlier. Parasites can create cysts. So in terms of this, we want to be active and proactive with this monitoring, because pancreas is one of those that is quick.
Yeah.
You're here, and if we pick it up and we're not monitoring, it's one of those that is just sadly is very, very quick. In 1-2 years, if we don't pick it up soon, there can be problems, right?
Yeah.
So the question is, should I wait for the recommended 1 year for MRI? We don't want to wait until there's symptoms, right? There's already something. Your body is speaking. There's a cyst. Cysts are not normal, although we don't want to normalize, even if it's small cyst. What's going on? What there's inflammation, like you said, if there's like flukes, if there's like infection, if there's like pancreas is one of those organs that have two functions. It's endocrine, it's exocrine. You have diabetes, or we have like blood sugar problems. So it's determining why do we have that cyst, and then monitoring. And yes, I will then absolutely monitor that sooner than later, and then educate the patient with red flag symptoms, what to do, how to feel, and then possibly look for parasites and treat that on candida, and reduce inflammation and infection, and then optimize blood sugar as well, and maybe digestive enzymes and herbs that can help with that, right?
Okay, so I think we're going to be doing this as our last question. Are we running out of time here?
Right.
Yeah, we're kind of like at an hour and 15 minutes, but okay. It says, I know some Chinese herbal supplements have been found to be toxic. Is there a good, safe brand you can suggest, particularly for liver and spleen health? And what is the best way, let me move this, what is the best way to heal the spleen? So I think we were talking about that earlier today. And, I mean, again, herbs, we have a specialist here, which is our acupuncturist. and she had recommended green herbs, and that is a company that she uses a lot. But again, it's an evaluation that needs to be done by someone who's really familiar with herbs. And so again, I would suggest for calling Gavin or our acupuncturist Yukari. That would probably where we would probably send you to get a little bit more in depth on that particular, because again, what is going on with the liver and the spleen. Like Alex said, there's going to be something that's related to some things that we may need to look at, because they don't just show up for nothing, right?
And Chinese medicine is it's just its own thing, right? Here in California, you need to have a master's degree or a doctorate, and to prescribe herbs, you even have to have a doctorate and be able to prescribe that. So in terms of a good brand, more so than the brands, finding a good acupuncturist that know their sourcing and know here our acupuncturist is well trained and it provide that option. But organs in Chinese medicine is not necessarily equals the organs in conventional or modern medicine, right? So that's something that we need to take into account, and that's what we do here. We just add both treatment plans, alternative modern herbs, and then the acupuncturist can provide some herbal recommendations that are safety. And if you ever are in the version, you can always do third-party testing and check your herbs and see if what they're telling you, and if they're clean, they actually are. So something that is just being proactive. Okay.
I'm just looking at the chat here. Okay. So it says, as a new patient, how do you determine which tests are run at the beginning? Are all the tests you mentioned part of the initial process, or can patients request specific tests? And if someone prefers to start with just the essentials, is that an option?
Right. I mean, we do shared decision making in the office. I ask them, do you want me to be your primary care? Do you have a primary care? What lab do you want to use? Do you want to do, what was the last time you did blood work? And we'll go from little to more. But thing is that sometimes you're really getting the blood draw. Sometimes money can be insurance, and there's many moving parts here in terms of the blood work and that piece that it can be settled. That's why we have patient advocates that beforehand, before you go to the doctor's office, we already have your blood work. We already have know all of your information, so we can help you the best, right? So that's something that if we can discuss in the office, and we can start with where we at. But of course, I will order where I feel as indicated, and you'll get to decide. But usually I'll just order a good comprehensive panel, check CBC, CMP, hormones, check vitamin D, vitamin B12, folate, and TMHR. We check viral infections. We check if you're vaccinated. We check for spike protein, and for COVID. We check for many things that we just need to do it, right? Like, I understand saying I meet the patients where they are, but sometimes it's just better to do a comprehensive look, because you're also going little by little can delay something bigger, right?
So this is a patient who says she's having extreme issues with sleep, and that she's got melanoma, and despite all that she's taking, for cortisol, she's doing breath work, she's done remote evoc, she's taking forced sleep, she's just taking a plethora of stuff, and she says she's still wide awake past midnight, and she's concerned about the impact that it's going to have on her recovery. I mean, obviously, if you're not sleeping well, it is going to affect your natural killer cells. And again, there's, I call it sleep hygiene, right? It's like, I'm not exposing myself to, blue light. I'm not watching TV. I'm not watching the news. I'm not, on my computers. I'm not doing anything stimulant. Take a hot bath maybe 2 hours before you go to sleep. Do the foam roller. Do some, meditation, prayer work. It's like, I had an issue with sleep. I didn't have a condition other than, like I said, I had Hashimoto's. And it took me a long time. And because of that lack of sleep, my natural killer cells went down, my cortisol levels went up, my adrenals got, thrown into chaos. So again, that's $1 million question, right? In regards to sleep. So we kind of look at it from all angles. Are you eating too late at night? Are you, do some journaling so that if there's stuff that's on your mind, then we want to make sure that we're not ruminating at night. And so,
yeah, I can add. So the supplements. So I've seen patients that react to vitamin C because it can upcharge your adrenals, or EMFs is something that we forget about. And so seeing that route of looking at electromagnetic fields, taking out the Wi-Fi from your room, any type of maybe you have a tower, a signal tower by your house. So getting a canopy or grounding your bed.
Yeah.
So just look outside, think outside the box, and
even like a dowsing, like sometimes
Right.
you may have a water line underneath your bed, and so again, you can buy it on Amazon, a dowser. It's like 2 copper rods, and you kind of go around the room, and if it goes, then you potentially have an area of stagnation, and so you would want to move your bed left or right and stuff like that.
Right.
So that's something that you can think about doing too. They're very inexpensive dowsing rods.
Right. So I would just also, this is not medical advice per se. This is not medical advice, period, right? But we will recommend, if you're a patient of us or our clinic,
yeah.
just also bring this question to your provider so we can help you out the best, right? And there's always options, and sleep is one of those that is tricky, and we just need to figure out what's going on in terms of the whole picture.
Yeah.
Right? Maybe we're missing one more question.
Yeah,
Right?
yeah, absolutely.
Right.
Okay, so I think we're going to end with that. Thank you so much. If you've stuck through this whole thing with us, it's 1 hour and 23 minutes. Usually we try to keep these under
Right.
an hour, but we're Latino, so we can talk.
Right.
We were never going to be short of words, that's for sure.
You guys like this? Let us know in the comments. If you want me to see me again, answering questions, bringing a topic, I'm more than open to come back and help you guys figure out next steps and your health. And this is awesome. Thanks for having me, Liliana and the team. And this is awesome. Thank you.
Okay, thank you, everyone. Good night.
Yeah.